The story for mindfulness and problems like depression and anxiety really begins with an important gap that we had. While we had a lot of successful treatments that involved looking at people's thinking and emotions when they were stressed, depressed, or anxious, what we also found clinically was that there was a lot of return of fear and return of depression. And what that meant to us was that we needed to find a treatment that did a better job of acknowledging that it was going to be impossible to eradicate negative, pessimistic, or anxious thinking completely. We needed a treatment that took into account that when stresses happen to people, when people are upset, they respond in a way that generates a lot of negative potential automatic thoughts and negative and anxious thoughts. So researchers and clinicians in the field were really left with a conundrum. They needed a treatment that allowed people to protect any gains that they'd made, allowed them to be better, but didn't count on eradication of negative thinking. And into that sort of gap, this natural gap, stepped the idea of mindfulness. And the power of mindfulness for treating depression, anxiety, and stress is that it acknowledges that the human mind has this innate capacity to step outside of these negative thoughts and to be more in the present moment. So what we needed then was a treatment that did several things. First and foremost, it needed to acknowledge that it wasn't going to be possible to eradicate all negative, anxious, or pessimistic or worry thoughts. It needed to acknowledge that these would arise. The treatment also needed to emphasize wellness. It needed to emphasize that people were going to be looking after themselves in a way that was different than they had before, and thus protecting any gains that they had made, whether they got better from medication or they'd gotten better through other kinds of psychotherapy. And so mindfulness just fit into that gap extremely well. And it's premised in the classic Jon Kabat-Zinn definition of mindfulness means paying attention in a particular way, in the present moment, and non-judgmentally. And that definition, together with Kabat-Zinn's MBSR program that had been running for decades at that point, for 8 weeks, was simply expanded upon and added to create MBCT. What does MBCT really then do? Well, first of all, it acknowledges that we have habits of mind, the monkey mind, or we call it automatic pilot, that are definitely part of being human, but less than ideal for wellness. It teaches us that we can turn inward, we can turn into the present moment, tune into our bodies, tune into our breaths, and therefore become aware of what's going on in the body and in the mind, both positive and negative. And after that kind of more basic training in meditative practice comes a really rather challenging moment for most of our patients, but really very critical, which is to let them know that the things that have been plaguing them, that feel like they are unwelcome, negative thoughts, worry thoughts, anxious thoughts, we teach them that those thoughts can be treated like old friends coming to visit you. That's not something that people are looking to do naturally. They, like us, would wish for an eradication of worry and negative thinking. So it's a bit of a breakthrough for them to have us acknowledge to them that this is unlikely, that what they really have to do is find a different way of being when they have negative thoughts, when they have anxious thoughts. And so over the course of the 8 sessions, people really transform the relationship that they have with negative and anxious thinking. They give those things much less energy than they previously would have. They spend less time battling those thoughts or fighting back, but they use a very meditative stance to open, soften, and accept wherever the mind is right now. And perhaps really oddly to them at first, when they are finished with their meditative practice for the day, they actually find that they're in a very different place than they thought they would be, and they report to us frequently that they make very different decisions after sitting with a negative thought than they would have if they had just been responding in the usual way. So how do we get them to be that? How do we get them there? Well, so it's an 8-week, 2.5-hour course, usually. We practice for about 40 minutes at the beginning of every session. We talk about our practices at home for about 20 minutes. We learn some new materials that can include audiovisual stuff. We do some readings. We do some chalkboard talks. And then we translate that back into practice homework for the coming week. So what are they going to be doing in the next week to further develop their skills? This approach in psychiatry was first popularized for treating depression, but since then it's actually grown. The list of modifications and applications to these strategies gets bigger almost every day. So recently this work has been adapted to the area of anxiety, disorders like obsessive-compulsive disorder, which have some of the same challenges as depression in terms of return of symptoms and just chronicity. It's worked for all kinds of medical conditions that have a mental health component. Probably the most prominent of those medical conditions are cardiovascular disease and cancer. And even problems that we think of as rather severe and intractable, post-traumatic stress disorder and borderline personality disorder, treatments for those conditions are developing mindfulness components, which really, I think, underscore the range of applicability for these strategies. The data also looks very promising. Typically what we see when we compare mindfulness-based practices to treatment as usual, like you might get in any community clinic or hospital, we can usually cut the rate of whatever we're looking at about in half, whether that's the rate of relapse risk, whether that's the amount of symptoms that people are experiencing. And there's also some good data to suggest that the effects of mindfulness are fairly long-lasting in a sense that if people adopt the practice into their life and they continue to do it, it continues to work. So it's more than just a short-term solution to a problem. As a practitioner, these are wonderful strategies to work with for patients. One of the things that isn't really written about in the textbooks but is important to talk about is the sense of empowerment that people get from day one. What you're suggesting is that there's nothing special about you providing advice to them. They don't need you to give them answers to some kind of problems. It's really established very early that mindfulness is a skill that anybody can learn if they put in sufficient practice and are devoted enough to it. So there's no particular magic to it. The second thing I really like as a practitioner doing it is that it's not in any competition whatsoever with the biological treatments for whatever disorder. So often there's a bit of a horse race between medication and psychotherapy. Should I do one? Should I do the other? And mindfulness really suggests and every day lives with the idea that the two, while they have something to do with each other, need not be in any form of competition, that it's perfectly reasonable for people to take all kinds of medical measures that they might need to look after themselves, but also contribute to their own wellness and take as much responsibility as they can. So it's a wonderful thing for patients to be part of. It's a great thing to be empowered. It's a lasting kind of strategy. The other thing that we have turned our attention to that's of great interest to us is mechanisms. So beyond knowing that it has a beneficial effect on symptoms and functioning, we're encouraged to ask the question, why? Because the truth is, while it's very effective for most people, it doesn't work for everyone. Some people go through these practices and we don't see the change. They don't see the change that they're hoping for. And with other people, we see very dramatic changes. So what is changing for people that makes the difference? And we've done some fairly careful kind of mathematical analyses where we've parsed this out. So some of the things that are changing include, I'm not so easily carried away by my feelings. I can separate myself from my thoughts and my feelings. I find myself observing unpleasant feelings without getting drawn into them. I notice the kinds of things my attention tended to become involved with, so tuning in. Finally, here's an item that's interesting because the reverse of this actually is a positive indicator. So if people say, I tend to walk quickly to get where I'm going without paying attention to my experience along the way, if they say yes to that, they're less likely to be doing well, which suggests that walking more slowly and paying attention to your experience is actually one of the things that's a positive indicator. So while that's hugely intriguing, it leads us back around to say, how do we get people to get to these kinds of ways of seeing themselves, right? And that's through that practice. So the summary would be that mindfulness-based strategies really do an excellent job of giving people a certain level of stability. They protect gains that people have made, and they also seem to more often choose strategies that suggest a higher level of wellness than they did before mindfulness. It's important to say that mindfulness isn't the same. We don't teach people to be passive or stoic or just to suck up difficulty because that's what life is. We teach them that acceptance is a major part of wellness, that simply to be with your experience as it is in the present moment, non-judgmentally, will allow you to get to a place that we call wise mind. And wise mind means being off automatic pilot, having sat with something, and then come to a decision as to how to handle it, including doing nothing about something. And that's hugely important. And we also think that it's a strategy that the benefits for which we simply don't know the full scope of. We're very keen to try this with other kinds of disorders beyond some of the ones I've mentioned. And we think that this has broad applicability to human beings on the planet, not just people suffering with a particular problem or another.